the Medical Practices webinar. This is the rescheduled webinar. It was originally supposed to be a few weeks ago, and we had some technical difficulties. So if you're joining us again this morning, thank you so much for your patience. And we'll go ahead and get started. Today we have Ms. Thelma Stewart, and she will be the presenter. She has been with Azalea for over 2 years now, and she has her CPC. And she also is the Vice President of the AAPC Savannah chapter. So we're very lucky to have her with us this morning. Thelma, welcome and thank you.
Good morning, Kiara. Good morning, everybody. Thank you. The title of our webinar this morning is The Value of Pre-Certification for Medical Practices. So let's get started. Today we will cover what is pre-certification, the importance of pre-certification. We will touch on some of the required procedures and services, what causes insurance denials. We will also discuss the service, the pre-certification service as a time saver for your practice. We will also discuss some of the challenges. I will also give you a demonstration of the Azalea PreCert dashboard. And then at the end, we will have a frequently asked questions portion, and then we will have a Q&A for the audience. So thank you once again for joining us. What is pre-certification? The purpose of pre-certification is the process of obtaining patient eligibility from insurance companies prior to hospital admissions and having certain elective procedures performed. This practice was created in order to limit unnecessary spending by requiring the payer to agree that a service is medically necessary before the claim will be paid. This process is done by securely transmitting patient data, and we communicate with the providers and the payers, and this is done through a fully HIPAA-compliant process. We obtain the pre-certification and approval requirements, and in turn, we transmit this information back to the hospitals, the outpatient facilities, and sometimes the patient if required. So you may ask yourself, why is pre-certification important to my practice? First and foremost, it ensures proper reimbursement for your practice or facility. Communicating with the payers for necessary authorizations and pre-certifications and entering patient data take hours of valuable medical practice time, and it is a very redundant process. Therefore, this increases overall workload, it leads to errors, and it can contribute to out-of-pocket costs, higher out-of-pocket costs. Half of the insurance denials that are involved with the payers are due to pre-certification errors. And in just 3 weeks alone, 3 weeks a year, interacting with the health plans, it costs the physician $64,859 annually, and that is pretty costly. It is also a very important service for rural hospitals because rural hospitals provide essential services to 54 million patients a year. So the hospitals want to make sure that their reimbursement for the services that they provide is secure, and that's one reason why this service is very important. So what are some of the things that causes insurance denials? A procedure may not have been prior authorized before they had it done. Improper coding could be one of them. If the provider fails to obtain the necessary financial clearance before providing these services, then the payer can deny either some or all of the claims. Even if it is denied, the provider usually has the right to appeal the denial through several levels. So that can be one of the issues that needs to be tackled. It can also be denied due to the patient's coverage terminated. If a patient failed to provide accurate or timely information to the payer or to the provider about his or her insurance coverage or their medical condition, the patient can be held liable for any charges that is incurred by either the provider or that the insurance payer improperly reimbursed the facility for. Either the medical services is not covered by their benefit plan. And then when it comes down to the claim can either be illegible, have missing information, or it's just simply not up to payer standards. There are many challenges that are associated with doing pre-certs in-house or doing it by yourself. As we touched on before, it takes valuable time away from the clinical staff. We know that the main purpose of the clinical staff as a provider is to make sure that the patient's needs are taken care of, and they want to make sure that this time is not taken away from them. When it comes down to insurance verification, that can be very tedious. Due to the numerous insurance companies that we come into contact with on a daily basis, all of them have third-party administrators for their health plans. So making sure that you have a copy of the patient's insurance card helps to eliminate unnecessary time trying to track down the correct department for the patient's benefit plan. There are also specific guidelines that must be met. And sometimes we have to research those guidelines to make sure all the T's are dotted and all the bullet points are correctly taken care of to make sure or to ensure that we could possibly get an authorization for the patient. Tracking the statuses requires constant follow-up. We have to follow the statuses several times, a few times a day, depending on the type of procedure and the urgent status of the request. And then working with the insurance companies to get the procedures approved in a timely manner can also be tedious. So these are some of the challenges of doing pre-certification in-house, and it can take valuable time away. So why is the Azalea Pre-Cert service a time-saving service for your facility or for the provider? We will allow you, by putting that, by allowing us to give you that service, it allows you to focus on your patient and giving quality patient care. All the staff member has to do is enter the patient data, and the specialist takes it from there. We actually take the hassle away from you. We offer a simple and secure web-based portal for you to enter your pre-certs. The specialist tracks and catalogs pre-certs based on the status and the request. The dashboard also has a built-in medical necessity verification, and that is based on Medicare NCDs and LCDs. The practice also receives email notifications every time there is a status update on a pre-cert, whether it's completed or there's additional information needed. You will receive an email notification. We also facilitate peer-to-peer reviews in which the doctor can communicate with the medical director with the health plan. So we do that also. There's a fast turnaround time, which leads to increased customer satisfaction. So now let's take a look at a demo of the Azalea Pre-Cert dashboard. And upon logging into the EHR, you will come to the EHR home or office view of the EHR. At the top, you will come across to the Pre-Cert tab and click on that. And when it opens up, you would come into the actual dashboard, which will give you an overview of all of your pre-certs. To your right here, the status column, you have a view of all the statuses from incomplete all the way to new. There is also color-coded, so that helps you to view which ones are most important also. The ones in yellow are incomplete. The ones that are in red represent a status or urgent request. So we will begin a new pre-cert, and in order to start a new pre-cert, you will come here, click on the new pre-cert button, and you can search for a patient either by name, date of birth, and it will have to be in the same format with the slashes, or you can search with the Social Security number, and it will also have to be in the same format with the dashes. We will search for the patient by name, and when you pull that patient up, you'll just simply click on it. and it will open up into a new PreCert. When you open up into a new PreCert, you will always start an incomplete, which is up here to your right, and this will always be an incomplete status. All of the patient information and insurance information will autofill, so you will not need to re-enter that information again. You have the patient's demographics here to the left and the patient's insurance information here to the right. All fields in red are required, so you do need to make sure those are filled in. Moving down, you have the rendering provider, and it's already filled in. You have your date requested, and it will always be the day that you enter the PreCert. So we're going to click today. If you have a scheduled date and time, you can just simply click on the calendar, click on the date, and just add in your time. You can select AM or PM. If it is a stat request, we have a button right here, which is directly across from the scheduled date. All you would have to do is click in that button, and that will alert us when you do finish that this is a stat request, and you'll see that when we click out. You will select place of service. Moving down to your ICD-9 code, if you already know the diagnosis code that you're going to use, you can just simply type it in. Click the Submit button, and it will populate below the gray line here. Or if you need to search for the worded description, you would just simply type it in. And it will populate all of the descriptive diagnosis for that particular diagnosis that you type in. If you, what you would do is just go ahead and click on it. Click the Select button. And it will again populate down below the gray line. Moving down to your CPT code, if you already know the code, you would do the same. Just type it in, click the Submit button, and if you need, it would populate below the gray line. Again, if you needed to search for the worded description, you would just click your search button here, type in the worded description, and it would do the same. Moving down to the claim detail section, this section is usually for workers' comp cases or for auto accidents. You would just fill this information out if needed. Coming down to the PreCert notes, here is where the staff member communicates with the PreCert specialist and vice versa. If there was anything that they needed to communicate, they would type it here. So for instance, we put in the patient had abdominal pain, and that the doctor wanted to get a CT of the abdomen and pelvis. What the staff member could communicate to us is that the doctor is wanting to rule out kidney stones. And you would simply just click Add Note. It would populate a name, date, and timestamp showing who communicated this information. It would also be a reference for us so we would know what's actually going. Coming down to the PreCert, this is also, before I go any further, also this is where you would look to see where the progress is step by step with the PreCert. So we also communicate where we are step by step with the PreCert. Moving down to the PreCert documents, in this section is where you would either click here to upload any chart notes, lab results, or CT results for the patient. For the purpose of our EHR clients who already have the Azalea EHR, what they could do is come back up to the PreCert notes and just simply type in and say reference chart number and type in the chart number. When they do that, that would be a reference for us that we could go directly to that patient's chart in the EHR and pull all the necessary information that we would need to complete the PreCert. Once you have completed putting all your information in, you would just scroll back up to make sure all fields in red are completed. everything that you wanted to make sure is in the PreCert is completed. And then you would click the Save and Close button. That PreCert will populate here. And this, being that we click the Stat button, it would show up in red for us, and it would notify us that we have an urgent request. We would also get an email notification notifying us that Dr. James Roberts has just put in a new PreCert. We would then pick it up from there and continue with the PreCert request. And that is a brief demonstration of our Azalea PreCert dashboard. Now, going to the pre-certification, frequently asked questions. One of the most frequent questions that we get is, what is the standard amount of time that insurance companies require for an authorization decision? All insurance companies require that we at least give them a standard time of 14 days to receive the information, input it into their system, and have it reviewed by either a nurse or a medical director. So that is the standard time. If it is a stat request for a surgery, the time differs. It can be anywhere from 3 to 5 days, but they do shorten it. The next question is, do insurance companies recognize stat procedures? I see this mostly when it comes to radiology procedures. Yes, they do. They do recognize it, but they consider a stat request to be urgent, where it would impair the patient from fully recovering to probably a normal status of their health. So they do recognize it. You could get an answer. If it's a stat request, you could get an answer within either right then and there or anywhere between 2 to 3 hours. It can take up to 24 hours depending on the imaging company or the insurance health plan. Now I'm going to open up the floor to any questions. Kiera, does anybody have any questions?
Yes, we've had a couple come through, and Thelma, thank you for that demo. That was great. First question is, are pre-cert specialists well-versed in CPT codes?
Yes, we are well-versed in CPT codes. We understand them enough to make sure in which we could decipher and read the clinical notes to make sure that the correct radiology code is being ordered, and so we are able to decipher if it will match based on the clinical notes, if it would meet approval or not.
Okay. The next one is, how much clinical documentation is necessary for pre-certification?
We request at least a history of 2 office visits. If there are any radiology or x-ray results, those are very helpful, and any lab results, those are very helpful.
Okay. We have one more. Is pre-certification required for x-rays?
No. For insurance companies, x-rays are very, very simple and can be done in the office. So when they can be done in office, no, they're not required. Pre-cert is not required.
Okay, great. Does any other attendees have any questions? You can go ahead and submit them in the questions text box now. Okay, while we're waiting on that, let's go ahead and move on to the next slide. Just want to talk a little bit about some upcoming webinars we have. We are in the middle of a ICD-10 Survival Program webinar series. We're doing this with the Hometown Health organization, and once a month we have an hour-long session with a professional that walks us through what we need to be thinking about each month. The next month, December session, will be held on the 18th, and the topics are infectious diseases and neoplasms and budget and reimbursement. There is a fee for it, so if you are interested in attending this webinar or signing up for the series, if you'll email marketing@azaleahealth.com, we can get you set up, and just by mentioning Azalea's name, you do receive a 10% discount. So it's a really great deal, and there's every month there is a whole bunch of really useful information that is shared. So it's definitely worth the money. Okay, Thelma, if you would mind going to the next slide for me. Well, Thelma, I do want to thank you so much for not only the first time we took time out of the day to go through this, but also today. That was a really great presentation and an awesome demo, and I think you really covered most everything that PreCert has to offer our practices. If anybody has any other questions, always feel free to email us at info@azaleahealth.com, and we'll get those answered for you. Thelma will see to it personally that you have the best answer possible. So Thelma, thank you again, and I guess everyone have a good rest of the morning.
All right. Thank you, Kiera. Thank you, everybody.
All right. Goodbye.